The doctor's in this afternoon, Dr. Zorba-Paster. We're taking your calls at 608-270-9933.
Phones are wide open, so if you have a question, it's a great day to call. Call now.
Welcome back, Zorba.
Yeah, good to see you.
Good to be seen.
I mean, it seems like all the plants outside were put in a microwave.
That's right.
They do boom, and allergies are exploding.
You hit it exactly that. You know, the good news is we've got great over-the-counter medications for allergies, and people really ought to go out and get them. So first of all, there's steroid inhalers like Flonase. That's one of the name brands, but it's fluticasone. And the thing about steroid inhalers is they are the best thing for anything with a stuffy nose. Put the steroid inhaler. It takes a day or two to kick in. Does not kick in right away. Takes a day or two. If you then use an over-the-counter non-sedating antihistamine during the daytime, Claritin generic, Zyrtec generic, Allegra generic, they're all good. They can really help you. And if it's really serious at bedtime, take some Benadryl. I mean, it's the best stuff, but it makes you sleepy. And that's what you do. And then eye drops, over-the-counter eye drops. Pataday is one of them. Ask the pharmacy about over-the-counter eye drops, but they really do all make a difference.
But how do you know if it's allergies and not COVID?
Well,
a lot of the symptoms are the same.
So the symptoms can be very, very similar. So one of the things you can do is you get one of those nifty kits that you can get from the government, and you can test yourself for COVID. And that's what I would recommend if you're worried about it. You can go to the store. You can show the insurance card. If you don't have insurance, there are ways that you can actually get those kits and you test. And remember, it may not show you have COVID, and you might have COVID, but the reality is just sort of finessing.
And maybe a fever would be the difference. You don't have a fever.
Well, but COVID is mostly asymptomatic. Remember, there is no assurance that you have COVID. And I got to give a great example. My daughter Dee Dee is a doc in Seattle, and she really is careful. She wears N95 masks, does everything all the time because she's worried about infecting people. And lo and behold, she called me today, and she has COVID just out of the blue. And she said, I don't know where I got it because I'm really, really careful. Well, the answer is most of us don't know where we have it. Luckily, this COVID that is circulating right now is not as serious as the COVID that was a long time ago. I mean, it's not like, you know, the COVID that was Omicron and all the other brands. This one is not as serious.
All right, and the vaccines help.
The vaccines make a big difference.
Let's go to Lynn in Beaver Dam. Hi, Lynn, what's your question?
Hello. My daughter was just admitted at UW Hospital with a spinal stroke, and they've done a bunch of tests and they can't figure out why she threw a blood clot to her spine. Just wondering if the COVID vaccine has any side effects with blood clots as she had the vaccine.
Well, very difficult to say. It's just one of those things that can definitely occur with COVID. We still don't really understand exactly what it is. And then, of course, we have other diseases, concurrent diseases that happen along with it. But the answer is get checked out. They're very good medications for exactly these conditions, and treat it.
I wish her the very best.
Best
Thank you for calling. Let's go to Steve in Dodgeville. Hi, Steve. What's your question?
Yes, I've been diagnosed with neuropathy, and I wonder if Dr. Zorba can give me some ideas to maybe some different kind of shoes or liners or
Yeah, how do you do it?
So I didn't quite understand.
Neuropathy.
Yes,
He has
So
neuropathy.
with neuropathy, gabapentin, pregabalin are very good drugs for neuropathy. They can really work well. They don't make you sleepy. They're not narcotics. They're not habit forming. And when you've got neuropathy, those are very good drugs that can help. Call your doctor. That's the most important thing. And then basically, that's how you can treat it. There are good treatments for neuropathy out there. It's a matter of you and your doctor having a good relationship to find them.
And it's a nerve damage thing.
It's a nerve damage thing, diabetes being the most common thing. Alcoholism being one of the more common things that also happen with neuropathy. It's nerve damage. Some people are very bothered, some are not, and you have to find the right medication to work for you to help you.
Well, let's revisit the mask issue. Some people are starting to, CDC's recommending you wear a mask in medium and high risk areas. We're in the medium area.
Yes. If you're immunized, if you've been careful, if you've been boosted, should you wear a mask? The answer is, I don't wear a mask in most situations. Now, I recently came back from Sarasota, Florida. I wore a mask when I was in the airport. I'm walking by a lot of people, so I wore a mask. But the reality is, tonight we're going to a party. Penny and I are going to a party. It's a wedding party. There'll be about 40 people in there. I am not going to wear a mask. If somebody has, ends up having COVID, I hope I don't get it, but I'm immunized. I want to start to live my life. I'm going to do it in a reasonable fashion. In the airport, yes. In a party, no.
All right, we have time for one more call. Let's go to Mary in Mount Horeb. Hi, Mary, what's your question? Mary, go ahead. All right, she has stomach pain, but also has her TV on too loud. Let's go to line 2. You're talking a question about booster brands?
Well, I didn't know if you should stick with the same for all your shots or if it's okay to go to another one.
Brand names for
some doctors say it's better.
Should you stick with Pfizer?
No, not at all. In fact, there's some very good reasons that you should actually, if you had Pfizer, get the Moderna booster. If you have Moderna, get the Pfizer booster. There's some very good ideas that you actually should mix and match.
Really?
Both are messenger RNA boosters, and there's some people who think that that's a good idea. So they're definitely, it's not a bad idea, and it might have turned out to be a good idea. I say, if the booster is available, get it done, and that's the most important thing.
Okay.
I went Moderna the whole way, and I'm done. I mean, I got 4 shots.
You'll be just fine. You have 4 shots. You're healthy.
All right, Zorba.
Well.
Thank you for calling in, everyone. We will do this again next week, and we'll have a final check of your forecast coming up.